This is how doctors can diagnose you with carpal tunnel syndrome. It's called the Phalen's test, and basically you put the back parts of your hand against each other and wait for about 60 seconds. And while you're doing that at home, let me tell you a little bit more about what carpal tunnel syndrome is. It's caused by compression of the median nerve, which is responsible for providing sensation to the first 3 digits of your hand. Most often, it presents with numbness and tingling first thing in the morning. If a person has already attempted conservative therapies such as wrist splints and steroid injections, then they might be considered a candidate for surgery. And if a person is a candidate for surgery, we actually open up the wrist and we decompress the nerve right at that level. It's done by making an incision just below the level of the wrist. We identify the structure called the flexor retinaculum, which covers the carpal tunnel. We make an opening in that ligament and decompress the median nerve. And typically, right after surgery, patients have an immense amount of improvement. And now that we're approaching the 1 minute mark, do you notice any numbness and tingling in your first 3 fingers? If you do, you might have carpal tunnel syndrome, and you should consider seeing a doctor for it. Because if you catch it early, there are many conservative measures that you can do to